Welcome to the first of two modules on the use of process flow maps. My name is Bob Zanni, and I will be presenting the key points of this quality improvement tool. Process mapping is a method of creating a diagram that uses graphic symbols to show the steps and the flow of a process. A high-level chart is used to show the big picture. Creating a high-level flowchart is typically an exercise linked to the 5 Ps. It is a 30,000-foot view of your system of care. Improving your practice is just like patient care. To improve a patient's health status, a clinician assesses, diagnoses, treats, and follows up based on biomedical science, patient preferences, and their outcomes. To improve a microsystem's health status, an interdisciplinary group assesses, diagnoses, treats, and follows up based on improvement science and performance feedback. Here is the microsystem improvement process spiral. The first phase of work is the assessment phase. The phase includes the establishment of meeting skills, constructing the 5 Ps, and creating a high flow chart of your system of care, which lives in the 5 Ps in the processes section. This slide highlights the progression through the assess phase as previously discussed. These are the further steps as you progress through the assess phase. A high-level flowchart is used here to show the big picture, or a view from 30,000 feet. Making a high-level flowchart is a good place to start mapping a process, and then you can proceed to determine what steps need detailed description. We will discuss detailed flowcharts in the next module. The high-level flowchart helps determine what steps need detailed descriptions, which will be shown on a more detailed flowchart. A process is a series of related work activities that together transform inputs into outputs for the benefit of someone. In mainstream healthcare, the inputs are the needs of a patient, family, or a population of patients, and the processes we wish to have deeper understanding of are the processes of healthcare service delivery. The outputs are the outcomes of the healthcare delivered. In other words, clinical results, functional outcomes, patient satisfaction, and costs. Keep in mind that every system is perfectly designed to get the results it gets. To stimulate our thinking and get better results, we need to design processes and systems with the desired results in mind. A flowchart is a picture of the sequence of steps in a process. Different steps or actions are represented by boxes or other symbols. These step-by-step pictures can be used to plan a project, describe a process, or to document a standard method for doing a job. Flowcharts can help team members understand what is happening now in a process. It's important to flowchart the current process, not the desired process. In other words, map the process as what is actually being done, not as you imagine it to be. These are the symbols commonly used to make flowcharts. An oval indicates the beginning and end point of a process. A box is an activity step. A diamond is a decision point where one responds yes or no. The elongated D shows delays in the process. Arrows are the directional flow of the process. A circle indicates that steps continue on another page or on another part of a larger flowchart. And a cloud represents don't know. What happens at this step is unknown or not understood. Here is an example of a high-level flowchart indicating a patient's flow through a clinic visit. It starts with room entry and ends with checkout. The simple steps in between the entry and exit are shown on this chart. Here is another high-level chart showing the process flow of acute myocardial infarction from entry to discharge. This is a high-level flowchart from the Cleveland Clinic Lung Transplant Center, mapping the process from referral from a CF program through to eventual transplant. Here are some hints on building your first-time flowchart. Select the process start and end point, and it might be easier to make a list of steps from start to finish by asking what happens first, then what happens, then what happens. Keep it simple. Turn listing of actions from start to finish into a flowchart using the basic symbols that I have just shown you. Additional hints is you could use post-it notes to make it easier to construct the map. Display your flowchart in your clinical area to invite engagement of other staff to contribute to the knowledge of the flowchart. And some important reminders: drawings, markers, flip charts are great for the construction of your flowchart. Not everyone has high-tech programs to construct the flowcharts, but Word or Excel is a good place to start. You can always save the beauty of the chart for later. Here is an example of a process flow map using post-it notes. Here are the additional references and further reading on this topic. I want to thank you for your attention. I hope that this has been informative, and I encourage you to view the next module on process mapping as it progresses from theme and global aim. And as always, good luck on your journey.